Shadow Minister, Dr. Luke Evans.
Thank you, Chair, and it's a pleasure to serve under your leadership today, and thank you for the introduction as well. And can I thank the member for Strangford for his detailed canter through something that is needed to be highlighted, and particularly a spotlight drawn upon. And particularly, I think he's hit the nail on the head with improving clinical pathways. And we, as a House, need to think about the best way to do that, to help the NHS to do that. And he exemplified that by telling Zoe's story, which I think the member for Bootle rightly highlighted the impact on patients, and that's the key crux of the matter here. And it was personified by the member for Mid Sussex with her story about Carrie, what Carrie and her mother have to go through, literally the living difficulties they're breathing every single day. And that coordination of care is so important. Now, the member for East Londonderry has left now, but his intervention was quite timely and pointed as well as about clinicians and awareness and training. And being a clinician, bringing that experience to the House, it is quite difficult to identify these issues. They are often masked by other conditions, and even with some of the tests that you can do, a random screening test will conclude rheumatoid factor, anti-CCP, antibodies, ESR, CRP, ANA, ANCA, and even things like anti-LO and anti-RA. But all of these may be positive or negative, and it can be indicative but not definitive of some of the conditions. And that's part of the problem we have with these rare diseases. And with 170,000 people, it means they are uncommon, but common enough for you to see them. And I certainly have treated several patients who've had things like SLE or Sjogren's or Raynaud's. And I think when we think about these things, we need to break them into two distinct groups: the connective tissue disorders, which includes lupus, scleroderma, myositis and Sjogren's, but also vasculitises, things like ANCA-associated vasculitis, giant cell arteritis and Behçet's. And by their very nature, because they are rare, they are hard to diagnose. And I'm hopeful that in the future, we may well have the likes of AI to help clinicians be able to identify or at least think about the differential diagnosis when it comes to dealing with these patients. It's a broad and difficult topic to break down, so I thought it might be helpful to take an approach of looking at both the framework to address rare diseases, the research behind it, the diagnosis and the workforce, and finally the treatment. So I'll take those all in turn. If we look at how to break this down, a framework to help the approach is really important. And under the previous government in 2021, the UK Rare Disease Framework was published to set out a vision to improve the care for people with rare diseases. And it had four priorities: delivering early diagnosis, increasing awareness amongst health professionals, improving access to a specialist team, and providing coordinated care. In essence, the care pathway. And this framework was designed to improve the speed of diagnosis, the coordination, and the access. In the words of the Rare Autoimmune Rheumatological Disease Alliance, the UK Rare Disease Framework has been a significant step in securing equity for treatment for rare diseases, and going forward, it's crucial that the government does not lose sight of the work done to date to drive changes for people living with rare conditions. So therefore, I'd ask the Minister my first question: how his government intends to build on the rare diseases framework, ensuring it remains adequately funded and relevant. Now, next we need the research, and this is the hardest part. As I pointed to, some of even the tests can't even diagnose things like Behçet's syndrome. It's often a clinical diagnosis. So the establishment of the Genomics England project, further mapping the genetic codes of individuals with rare conditions, was a move held by researchers worldwide. The programme, though ostensibly broad, directly benefits patients of rare autoimmune rheumatic diseases by identifying genetic markers and enabling targeted treatments. So my second question to the Minister is: what progress has been made in expanding genetic research to uncover new treatment options for these kind of diseases? Earlier this year, the government published an action plan that would include significant new commitments against each of those four framework priorities, including the health inequalities that we've heard so expertly talked about today. The action plan highlighted this significant investment made in driving research for the diseases, including a £14 million investment to the UK Rare Disease Research Platform. This facilitates greater collaboration between academics, clinical and industry research, as well as people living with rare diseases, research charities and other stakeholders to try and accelerate the understanding and the diagnosis and therapy of these diseases. So I was pleased to stand on a manifesto committed to take forward the Rare Disease Action Plan. Now, I fully accept there's more needed to be done, and the new government must work closely with its delivery partners on this. And in a recent written response, I was pleased to see that the government reiterate its support for research into rare diseases. It further highlighted the Department for Health and Social Care has invested $2.2 million for the National Institute of Health and Care Research to carry out research programmes related to rare genetic diseases. And, of course, the $340 million to Genomics England. Now, in my medical training, actually, I come from the University of Birmingham Medical School, and they actually have a University of Birmingham Centre for Rare Diseases, an exact collaboration to try and pull together all the academic research. And that translational research, because as we pointed out, as we keep saying, these are rare, so by definition to do the trials, you need to have a wide pool to pull people together to try to work things out. So I hope the member for Strangford will take some interest that actually they've joined up with the Belfast Queen's University to be able to research and collaborate across the 4 nations, including Newcastle University. And I remember back in 2015, I had the privilege of going to visit that centre as well. So it's a note for himself to look into that. Therefore, will the government continue to be increasing funding specifically for rare autoimmune rheumatic diseases, especially within the Medical Research Council's Care for Rare Disease programme? Then we need to look at the workforce and testing capacity. And over the last few years, the government has allocated $2.3 billion into community diagnostic centres. We know there are almost 170 across the country. These are really, really important for doing blood tests, ultrasounds, MRI scans, CT scans. And in my own constituency, I'm lucky enough to have £24 million invested. One is being built as we speak. And this is revolutionary for our area because for too long, people had to travel to the likes of George Eliot or into Leicester. Now they can have these kind of tests right here in their community, which is swifter access, which will hopefully help the likes of Zoe that we heard, making sure that she's one of the lucky ones getting swift access. But within that, we also then need to be able to have the people to be able to do the tests and understand the specialisms. So could I ask the government, the Minister will tell us, will they be expanding the network of CDCs any further? And regarding staffing, the last government brought forward the NHS workforce plan. How is the government looking at addressing both rheumatology and radiology in that plan to make sure there are no gaps? And finally, of course, we have treatment. That's the one thing we're looking for. We've got that diagnosis. We need that treatment. So innovative drugs are coming, the likes of immunotherapies, but they often come with high price tags. And so with NICE looking at how to speed these things up, but would the government commit to ensuring that these processes are accelerated so that we can actually make sure people get these drugs, the innovative drugs, as quickly as possible? But we shouldn't forget there are standard drugs that are used as well, the likes of things like methotrexate. Now, they can be quite dangerous drugs, so I'd ask the government what they're doing to ensure there's safe usage of these kind of drugs, because disease-modifying medications are really important. They can have high toxicity if not used properly and can therefore cause harm, so safety is really important. So in concluding, the legacy of the previous government is one of framework established, investment being made, and a road to improve lives. For the 2024 general election, the Rare Autoimmune Rheumatic Disease Alliance published a manifesto which called on the government to ensure that rare diseases remain a priority, develop a quality standard for rare diseases, and develop a better support for specialist networks. So how will the government work to consider and address these points? And overall, I hope this debate has highlighted exactly those calls, because we're unanimously agreed this is what we need: research, networks, support and treatments for these individuals who are suffering.